Good morning, Aldrin. I'm Mihiraa. Let's begin the warm-up session. Can you tell me about a challenging patient care situation you've encountered and how you handled it?
Certainly. In one instance, I had a patient who was resistant to following their treatment plan, due to fear and anxiety about their diagnosis. To address this, I took the time to listen to their concerns empathetically, and provided education about their condition in a way that was easy to understand. I also involved the patient in developing a personalized care plan that addressed their specific needs and preferences. By building trust and rapport with the patient, I was able to overcome their resistance and facilitate their compliance with the treatment plan.
How do you prioritize your tasks when you have multiple patients with varying needs?
Prioritization is essential in nursing, especially when juggling multiple patients. I typically start by assessing the acuity of each patient's condition and identifying any immediate needs or interventions. I then prioritize tasks based on urgency and the patient's condition, ensuring that critical interventions are addressed first. Additionally, I regularly communicate with the healthcare team to coordinate care and ensure that all patients receive timely and appropriate attention.
How do you handle conflicts or disagreements with colleagues in a healthcare setting?
Conflict resolution is an important skill in nursing, and I approach disagreements with a collaborative mindset. When conflicts arise, I strive to understand the perspectives of all parties involved, and actively listen to their concerns. I then work towards finding common ground and mutually beneficial solutions through open communication and compromise. Additionally, I'm not hesitant to seek guidance from supervisors or utilize appropriate channels for conflict resolution if necessary, always prioritizing the well-being of our patients and the effectiveness of our team.
Can you describe a time when you had to adapt to a sudden change or unexpected situation in your work environment?
Adaptability is a crucial trait in nursing, and I've encountered numerous situations where I've had to quickly adjust to unexpected changes. For example, during a shift, we experienced a sudden influx of patients due to an emergency situation in the community. In response, I swiftly mobilized resources, reassigned tasks, and collaborated with my team to ensure that all patients received timely and appropriate care. By staying calm under pressure and remaining flexible, we were able to effectively manage the situation and provide quality care to those in need.
How do you ensure patient safety and maintain confidentiality in your practice?
Patient safety and confidentiality are paramount in nursing, and I adhere to strict protocols to uphold these principles. I ensure that patient information is handled with the utmost discretion and only shared with authorized individuals on a need-to-know basis. Additionally, I consistently follow established safety protocols and best practices to prevent errors and minimize risks to patients. This includes thorough documentation, medication administration checks, and maintaining a clean and safe environment. Furthermore, I actively engage patients in their care and empower them to advocate for their own safety and privacy rights.
You can now start your OET roleplay.
Good morning, my name is Adrin Souza, one of the nurses in the clinic. How can I assist you today?
Hi, I'm here because my son's doctor recommended he get the flu vaccine, but I'm really worried about potential side effects and whether it's even effective for him, considering he has type 1 diabetes.
I can imagine how worrisome it must be to consider the potential risks for your child's health. Well, how may I address you?
You can call me Mihiraa.
Mihiraa, it's crucial to acknowledge and address these concerns, especially when it involves your child's well-being. Children with diabetes are particularly vulnerable to the complications of influenza due to their weakened immune systems. The flu can escalate into more severe conditions like pneumonia and may even require hospitalization, which can be quite daunting, especially for parents like yourself, who want to ensure the best possible care for their child.
That sounds scary. I want to do everything I can to protect him.
It's incredibly important to highlight the significance of influenza vaccination, especially considering your child's health condition. Mihiraa, getting vaccinated annually is essential because the influenza virus evolves constantly, making it crucial to stay protected each flu season. By receiving the vaccine, your son not only reduces his risk of contracting the flu but also lowers the likelihood of experiencing its complications, such as pneumonia or hospitalization. Given your child's vulnerable state and compromised immune system due to diabetes, the influenza vaccine serves as a critical defense mechanism. It helps fortify his immune system against the flu virus, reducing the chances of him falling ill or facing severe complications. Ensuring his safety and well-being is paramount, and vaccination is a proactive measure that can significantly contribute to his overall health and quality of life.
But is it safe for him? And how effective is it really?
I understand, Mihiraa. As a parent, your primary concern is the well-being of your child, and it's entirely natural to have worries, especially when it comes to their health. Regarding the safety of the influenza vaccine for diabetic children, rest assured that extensive research and rigorous testing have been conducted to ensure its safety profile. While some mild side effects such as soreness at the injection site or a low-grade fever may occur, serious reactions are incredibly rare. Additionally, the vaccine is carefully formulated to minimize any potential risks, particularly for children with compromised immune systems like your son. Well, Mihiraa, do you have any concerns or questions?
Thank you for explaining that. By the way, how the vaccination is done?
Good question, Mihiraa. When it comes to administering the influenza vaccine to children, we aim to make the process as straightforward and convenient as possible. Typically, the vaccine is given during a single visit to our clinic, and will ensure to schedule a vaccination appointment that fits into your schedule seamlessly. Now, for diabetic children like your son, there are specific considerations we take into account. It's crucial to monitor his blood sugar levels before and after vaccination to ensure they remain stable. In case of any adverse reactions, such as mild symptoms like soreness at the injection site or a low-grade fever, over-the-counter medications like paracetamol can help manage these symptoms effectively. However, if any symptoms worsen or if you have any concerns at all, please don't hesitate to contact us immediately or consult your doctor. Your son's health is our priority, and we're here to support you every step of the way throughout the vaccination process.
Okay, I think I feel a bit better about it now.
That's great to hear. Mihiraa, would you like to schedule an appointment for your son's flu vaccination?
Yes, please. Let's go ahead and do that.
Perfect, I'll take care of that for you. Just to summarize our conversation, Mihiraa, we've discussed the risks associated with influenza for children with diabetes and how it can lead to severe complications such as pneumonia or hospitalization. We've emphasized the importance of the flu vaccine in protecting your son from these risks, highlighting its effectiveness and safety, especially for diabetic children. Addressing your concerns, we've reassured you about the safety profile of the vaccine, acknowledging your worries and providing information on potential side effects. Moreover, We've discussed the vaccine administration process, ensuring it's a single-visit appointment and addressing specific considerations for diabetic children, such as monitoring blood sugar levels and managing any adverse reactions. If you have any further questions or concerns, please don't hesitate to reach out. Your son's health is our priority, and we're here to support you every step of the way throughout the vaccination process.